I mean, in just the first 6 months of this year, 200,000 veterans suddenly gained access to this massive healthcare system, a system they were previously told, just wasn't for them.
Right, and they didn't just quietly sign up and, stick a card in their wallet. They immediately generated 500,000 medical appointments.
Which is just a massive systemic shockwave.
Oh, absolutely. It's a staggering logistical and, well, cultural shift. We are really witnessing this fundamental rewiring of how the government interacts with former service members, moving from a culture of gatekeeping to a culture of active recruitment.
Which brings us to the core of what we're analyzing today. Welcome to this week's Deep Dive. We are looking at a weekly veteran news roundup, pulling apart a stack of government news releases, congressional reports, and policy updates for the week of July 13th to July 19th, 2026.
And as you comb through all this data, there's really one overarching theme that eclipses everything else.
Access. Exactly. We are looking at the shifting machinery of who gets veterans benefits, how those benefits are delivered, and, who is still fighting this invisible system to get in. So whether you are a veteran navigating this yourself, a family member trying to decipher the paperwork, or just someone fascinated by how massive government bureaucracies actually function on the ground, we are going to break down the exact operational levers driving these changes.
Because the conversation has completely evolved. I mean, a decade ago, the debate was primarily about what the benefit should actually be. Today, the defining question is about the mechanisms of delivery and the changing legal definitions of who actually qualifies.
The landscape is shifting rapidly, yeah. Okay, let's unpack this. Starting with this unprecedented enrollment surge. On July 9th, the VA announced that over 200,000 new veterans have enrolled in VA healthcare so far in 2026.
Which is a staggering number for just half a year.
It really is. And to understand the scale of that, we have to look at the historical operating mechanism of the VA. For decades, the system functioned a lot like a legacy computer operating system. Think of an old DOS prompt.
Oh, that's a good comparison.
Right. The resources were in the machine, but if you didn't type in the exact right command codes, you got a syntax error, and you were denied. It's like having a platinum tier health club membership that you earned through literal blood, sweat, and tears, but you never activate it because you either think you don't qualify or you just can't find the front door.
That is a highly accurate way to frame it. Because historically, large bureaucracies, they operate on a passive model. They secure the funding, they build the hospitals, and then they just wait for the citizen to decipher the maze and come to them.
And if they couldn't figure it out,
then that was viewed as the veteran's problem. What's fascinating here is the strategic shift to an active, aggressive outreach model. The VA is effectively building a modern, user-friendly interface now. They aren't waiting for the veteran to figure out the code anymore. They are actively pushing the update to the user.
And a massive piece of that new code is the PASS-ET Act, which really blew the doors wide open for eligibility.
Exactly. The PASS-ET Act altered the underlying logic of causality within the VA system.
Meaning the burn pits and toxic exposure legislation.
Right. Previously, the burden of proof was entirely on the veteran. They had to medically prove that a specific respiratory illness they developed in, say, 2025 was directly caused by inhaling toxic smoke on a specific deployment back in 2005.
Which is incredibly difficult to prove clinically.
Nearly impossible in some cases. But the new legislation removes that burden. It establishes what they call presumptive conditions. If you served in certain geographic areas at certain times and you develop a specific cancer or respiratory issue, the system now automatically presumes it was caused by your service. Yeah, that legal mechanism is the main engine driving this 200,000 person enrollment surge.
And the downstream effects of that legal shift, they're immediate. Out of those 500,000 new appointments you mentioned, 60,000 were specifically for mental health.
Yeah, that number is heavy.
It tells a story of massive delayed care.
It does. It reveals the profound friction that exists in seeking mental health treatment. Because entering a therapist's office, it requires a tremendous amount of vulnerability and trust.
Right.
When the government spends years telling a veteran they don't qualify for care because they can't, prove the causality of their trauma, it builds this massive wall of institutional distrust.
Absolutely.
So by proactively reaching out and changing the legal threshold for entry, the VA is aggressively lowering the cognitive load it takes for someone who's been struggling in silence for a decade to finally ask for help.
And the urgency of that outreach, it's reflected in another data point from this week. 2,100 of those new enrollees received emergency care at a VA facility.
That is over 2,000 immediate acute crises managed.
Solely because these individuals were finally brought inside the system. And to accelerate this, the VA is launching over 140 Freedom 250 events this summer. It ties into the country's upcoming 250th anniversary. They are setting up at hospitals and vet centers specifically to market directly to veterans who haven't signed up yet.
Which brings up a critical operational question, I think.
Yeah.
Marketing is great, but you cannot invite 200,000 new people to dinner if your kitchen is already on fire.
Right. The VA has historically been completely paralyzed by claims backlog.
Exactly. Yet the data shows the backlog of veterans waiting on benefits claims has actually dropped by 74% since January 2025.
See, that is the part that genuinely confuses me. How do you inject 250,000 new users into a system and simultaneously drop the backlog by 74%? They got it under 70,000 in June for the first time since 2020. What operational levers did they actually pull to prevent a total system collapse?
Well, it comes down to parallel scaling. They didn't just expand the legal eligibility. They aggressively expanded the physical and administrative infrastructure before the surge hit.
Like what?
They've opened 38 new healthcare clinics since the start of 2025.
Well,
Furthermore, they automated significant portions of the claims processing for these new presumptive conditions.
so because of the PAYCT Act.
Right, because it removed the need for lengthy medical investigations into causality for those specific illnesses. Those claims can move through the system with a fraction of the administrative friction.
Okay, so the VA is successfully upgrading its operating system to pull all these straightforward claims in, but that really throws a harsh spotlight on the veterans the system is legally hard-coded to reject. Which leads us to our next topic, the invisible barrier of bad paper discharges.
If we connect this to the bigger picture, the military justice system and the veteran benefit system are distinct entities, but they're intrinsically linked by one piece of paper, the discharge certificate.
How you leave the military dictates your entire trajectory within the VA. Let's look at the congressional roundtable that took place on July 15th at the Cannon House office building. Representative Mark Takano, the top Democrat on the House Veterans Affairs Committee, led a 2-hour session entirely focused on bad paper.
Right.
When we look at the roughly 15% of troops separated with other than honorable or bad conduct discharges, we see a massive systemic hurdle.
To put some hard numbers to that hurdle, data from the Council on Criminal Justice shows that between 2001 and 2013, roughly 216,000 troops received an other than honorable discharge.
216,000.
Yes. And consequently, about 125,000 former service members from that specific era were outright denied access to VA healthcare, the GI Bill, and disability pay.
But I want to challenge the premise of this entire roundtable for a second. The military is an institution built entirely on discipline and chain of command. If a commanding officer officially kicks someone out for misconduct or drug use, isn't the VA stepping on the Defense Department's toes by trying to rewrite that history? I mean, why should a civilian health agency get to override a military disciplinary action?
That is the exact friction point between the two departments. The Department of Defense is focused on immediate unit readiness and lethality. If a soldier is exhibiting erratic behavior or insubordination, the military's priority is to remove the disruption to the unit.
Makes sense.
The VA, however, is tasked with looking at the long-term medical causality of that behavior.
Meaning the behavior that got them kicked out wasn't just a discipline issue.
Precisely. The historical tragedy here is that the military justice system often punished behaviors that were actually direct medical symptoms of the service itself.
Oh, wow.
Yeah. Suppose a service member survives an IED blast, suffers an undiagnosed traumatic brain injury, and subsequently develops substance abuse issues to self-medicate the untreated pain and PTSD. The immediate chain of command often just saw a drug problem to be excised, not a combat casualty requiring medical intervention. So they are discharged with bad paper, which then explicitly prevents them from accessing the VA medical care required to treat the brain injury that caused the behavior in the first place.
That is a devastating institutional catch-22. You are punished for the symptom, and the punishment legally bars you from the cure.
Which is why that July 15th roundtable featured a massive coalition of advocacy groups. Swords to Plowshares, the VFW, the American Legion, Sparta Fried, the Black Veterans Project, and the Hispanic Veterans Leadership Alliance.
All at the same table.
Yes. They are not just asking for leniency, they're pushing for a unified systems change, highlighting how bad paper has historically been weaponized against service members suffering from military sexual trauma, or even applied disproportionately based on race or sexual orientation under older policies.
Wait, so if you have bad paper, is that a permanent life sentence? Are you just locked out of the VA forever? What is the actual mechanism for recourse here? If someone listening has been living with bad paper for 20 years, assuming they are permanently locked out, how do they actually navigate around that invisible bouncer?
Well, the most vital piece of information is that the door is not permanently sealed. When a veteran applies for care, the VA has the independent authority to conduct a character of discharge review. And the operational rules for this review changed significantly in 2024 with the introduction of a compelling circumstances exception.
Compelling circumstances. How does that exception change the math for the veteran?
It legally mandates that the VA must weigh context, not just the final military infraction. They have to consider compelling factors like mental illness, traumatic brain injuries, combat hardship, and any history of abuse or discrimination.
So they look at the whole picture.
Exactly.
Yeah.
If the VA determines those factors mitigate the misconduct, they can grant full access to VA benefits regardless of what the Department of Defense wrote on the discharge paper.
Alternatively, you can go straight to the source and apply to a military discharge review board to have the Department of Defense retroactively upgrade the discharge itself, right? But navigating a military tribunal retroactively sounds like a legal nightmare, like something that requires thousands of dollars in attorney fees.
It can be highly complex, yes, but there is a crucial financial safeguard built into federal law. It is illegal for anyone to charge a veteran a fee to file their first VA claim.
Wait, really?
Yes. Accredited veteran service organizations, like the one sitting at that congressional roundtable, they exist to help veterans build these appeals, gather the medical evidence, and navigate the tribunals completely free of charge.
That is a massive resource. Okay, so we've examined the active outreach pulling people into the system, and we've analyzed the legal mechanisms to upgrade a discharge status to get past the gate. Let's look at the tangible economic value of what is actually waiting inside, because on August 1st, the financial math of the post-9/11 GI Bill changes.
And the post-9/11 GI Bill is arguably the most impactful piece of veteran legislation of the 21st century. To establish the baseline, full benefits are awarded to those who served at least 36 months on active duty, with prorated percentages for less time. And the new rates taking effect cover the academic year from August 1st, 2026 through July 31st, 2027.
Here's where it gets really interesting. When most people hear GI Bill, they immediately picture a tuition voucher for an 18-year-old heading off to a traditional 4-year state college. And while it absolutely does cover the net in-state tuition and fees for public colleges in full, viewing it strictly as a university voucher completely misses the point.
It is entirely more robust than a tuition voucher. The GI Bill is essentially a generational wealth transfer mechanism. By removing the anchor of crippling student loan debt, it allows the veteran, or critically, the spouse or child who inherited the transferred benefit, to enter the middle class, purchase homes sooner, and accumulate capital decades earlier than their civilian peers.
And it recognizes that the modern economy doesn't run exclusively on bachelor's degrees. If a veteran wants to attend a private or foreign school, the base tuition cap is rising by 3.3% this August, hitting just over $30,908. But the mechanism that really drives the economic engine is that the same funding applies to non-degree programs.
That adaptability is its greatest strength, without a doubt.
Exactly. If a veteran wants to bypass university and get certified in HVAC repair, go to truck driving school, or complete EMT training, the trades are fully backed by this benefit. There are dedicated caps for other specialized pathways, too. Flight training has its own limit just north of $17,600, and correspondence courses are capped just over $15,000.
The system bends to fit the actual career trajectory the veteran wants. But, the tuition coverage is only half the economic equation. The mechanism that actually allows a 26-year-old veteran with a spouse and a child to stop working full-time and attend an electrical apprenticeship is the housing allowance.
Let's examine how that allowance is calculated, because at first glance, it seems wildly open to exploitation. The housing stipend is tied directly to the zip code of the school, matching the 2026 housing allowance of an E5 military rank, like an Army sergeant, with dependents.
Right.
Doesn't tying the stipend to local zip codes just incentivize veterans to flock to high-cost areas like San Francisco or New York City strictly to pocket a massive monthly housing check?
That is a very common critique, but it fundamentally misunderstands the economic philosophy of the policy. The localized stipend is designed to prevent geographic lockout.
Geographic lockout.
Yeah. If the VA provided a flat national average for housing, a veteran from a working-class background would be effectively priced out of attending top-tier institutions in major metropolitan areas, regardless of their academic qualifications.
Ah, I see.
By tying the allowance to the local zip code, the VA ensures the veteran can afford to live where the best opportunities actually are. Furthermore, that money doesn't disappear. It acts as a direct injection of federal capital into local microeconomies across the country.
That reframes it completely. It treats the veteran as an active participant in the local economy, not just a passive student. And the policy accounts for different educational models as well, doesn't it?
It does. If you are taking all your classes online, you aren't tied to a high-cost physical zip code, so the housing allowance is capped at 12,261 hours a month. If you are physically attending a foreign school, the international rate goes up to $2,522 a month.
There are also highly specific logistical provisions built into the new rates, too. The VA provides an annual stipend of up to $1,000 strictly for books and supplies.
And they recognize the hidden geography tax. Veterans who live in a highly rural county and must physically relocate a significant distance just to access higher education, they are eligible for a one-time $500 relocation payment.
Which is huge. And for those eyeing elite private universities where the tuition vastly exceeds that $30,908 cap, there is the Yellow Ribbon program. If the private school participates, they enter an agreement with the VA to fund the tuition gap, meaning a veteran could potentially graduate from an Ivy League institution completely debt-free.
Which circles us back to the overarching theme of access. The layers of economic support, the tuition caps, the localized housing allowances, the rural relocation fees, they are phenomenally powerful. But their actual value to a veteran who was locked out by an unfair bad paper discharge is exactly zero.
So what does this all mean? We have navigated the full spectrum of veteran access today. We broke down the operational mechanics behind the VA's massive push to enroll 200,000 new veterans, exploring how the PAYCT Act altered the legal threshold for care.
We examined the systemic friction of bad paper discharges, challenging why medical casualties were punished as disciplinary failures. And we outlined the new 2024 compelling circumstances exception that provides a real pathway back.
And we unpacked the actual economic philosophy driving the new August 1st GI Bill rates, highlighting how it functions not just as an educational perk, but as an engine for generational wealth.
The unifying thread through all of these sources is that the veteran benefit system is a massive, highly adaptable machinery. It is designed to reward service, but it requires the user to understand the operating system. You have to know how the legal definitions are shifting, you need to understand the avenues for appeal, and you really have to know how to leverage the exact financial mechanisms available in 2026.
As we close out this week's analysis, what is a final concept our listeners should walk away with? Something that builds on the shifting machinery we've explored today.
Consider how society's very definition of honorable service is rapidly evolving right in front of us. We discussed how behaviors that got a service member discharged in disgrace 20 years ago are now rightfully recognized by the VA as severe combat injuries, like traumatic brain injury and PTSD, injuries deserving of comprehensive care and legal exceptions. If our medical and bureaucratic understanding of human trauma has shifted that drastically in just 2 decades, how might our entire cultural definition of a successful military career change in the next 20 years? We are finally learning that the true cost of war isn't always visible, and our massive governmental systems are only just now rewriting their code to catch up to that medical reality.
A system finally learning to treat the human reality rather than just processing the paperwork. Thank you for joining us on this deep dive. If this analysis clarified the landscape for you, please pass this information along to the veterans or military families in your orbit, because as we saw today, understanding how the machinery works is the first required step to actually benefiting from it. We'll see you next time.